Hello, everyone, and welcome to another audio podcast in this series around the pathology storm. This is the Shientist, and as part of the Shientist Chartered edition, as a Storm Logistics production in collaboration with the Renal Patient Support Group, or the RPSG. And today I'm going to provide an overview in this audio podcast around the renal health and COVID-19 correlation. As with the previous audio podcast in this particular series, the audio podcast will relate to a peer review manuscript that was an invited manuscript towards a book chapter in relating to the sciences, and in time it will be available through the Renal Patient Support Group, or the RPSG. So to begin with, I'm going to provide this perspective on in this audio podcast around the renal health and COVID-19 correlation. So it's been highlighted that the first pandemic caused by coronaviruses, or SARS-CoV, occurred in around 2002 to 2003 in Asia, wherein just over 8,000 patients or individuals, 8,096 patients were evaluated positive for the virus, and as a result, 774 deaths had been documented. And despite common acute respiratory failure caused by diffuse alveolar damage, multi-organ failure was also noticeable when there were cases of severe diarrhoea, hepatic failure, and acute kidney injury. So an investigator from Hong Kong, after evaluation, highlighted that 536 SARS cases, so around 6.7%, so just under 7%, developed acute kidney injury. And moreover, the mortality amongst this group was just under 92%, so 91.7%, which was significantly higher than in patients without any symptoms of acute kidney injury, or AKI. So in following that, the Middle East respiratory coronavirus, or MERS-CoV, also induced two epidemics. One in 2012 surrounding countries in the Middle East, and then one subsequently in 2015 in South Korea. The MERS-CoV implicated the lives of 2,562 people, resulting in 881 deaths. To determine possible nephrological complications associated with MERS-CoV, investigators from South Korea examined 30 patients by monitoring vital signs, bacterial culture of body fluids, and virus through polymerase chain reaction investigations. And then within a testing group, proteinuria occurred in around 40% of cases, and haematuria in around 63, just over 63%, 63.3%, and acute kidney injury developed in around 26, just under 27%, so 26.7% of patients. And mostly the symptoms or symptomology was evidenced in the elderly. And so the current outbreak, or at least the outbreak that had taken place between 2000 and 2018, or late 2000, mid 2018 and 19, and which originated from originally from the Wuhan province in China, spread worldwide, threatening life. And so within the period, or the duration between 1st of September 2020 to around 31st of August 2021, 5,600,042 and 190 cases of COVID-19 were detected in the United Kingdom, in England, the United Kingdom, wherein 94,815 cases led to death. And despite being uncommon, renal complications were correlated, or have been correlated, to pathophysiology determined by the effects of COVID-19 infection, mainly because of acute kidney injury. Moreover, the risk of individuals who are prone to renal insufficiency to contract COVID-19 is higher, and thus interventions have been required to prevent and preclude further renal complications and cardiovascular disease. In this audio podcast, I wanted to provide sort of an overview, around the renal health and COVID-19 correlation. And so the next audio podcast in this series around the pathology storm will look at renal cells and COVID-19. I've been your host. This is the Shientist. In this audio podcast series around the pathology storm, it's the Shientist Chartered Edition, Storm Logistics production in collaboration with the Renal Patient Support Group, the RPSG. Thank you for tuning in.